Oh my goodness.
Yeah. Yeah, 90s. So I'm still admitting people.
Okay,
So maybe if we can give them 5 minutes maybe and then we start, or what do you think?
sure. I've just queued up slides. Do you see them?
Yeah, yeah, I
Okay.
can see them.
Um, so perhaps I'll wait a couple minutes and then I'll introduce myself. Does that sound okay?
Yeah, yeah, it's okay, I think.
Okay. Hi, everyone. Uh, my name is Tricia Aung. I'm just going to start and introduce myself while people are trickling into the Teams room. I am a research faculty at Johns Hopkins School of Public Health. I specialize in data visualization for policymaking and for low-income country audiences. And so I'm really excited to join you today to talk about some of the work, the research, the data visualization research that has been done on how to optimize data visualization based on your audience and key messages, and and also to take into account the context and type of work that you're doing, particularly with a journalism angle for this session. So I'm going to turn off my video for the actual presentation, just for everyone's internet. If you have any questions, feel free to type them in the chat. And also you'll have time to ask questions at the end. So why don't we get started? Can you see my slides?
Yes.
Wonderful. So at Johns Hopkins School of Public Health, I currently support a project called Datadent. So it's data for decisions to expand nutrition transformation. And it's a Gates Foundation funded project on improving the use of nutrition data, so both collection and dissemination. However, this data visualization work started actually from my work in Tanzania in the past 5 years. And so I really love giving these types of trainings because it's really interesting to me personally as a public health professional, because I feel like data visualization isn't necessarily taught in a very strategic way. So I'm guessing when you were probably, in primary school and learning about different ways to visualize data, you learned about bar charts and pie charts and line graphs. But not so much the theory behind why you might use certain strategies based on what people can comprehend. And so that's going to be the emphasis of the next 2 sessions with you. So I have an hour today with you and then an hour tomorrow. And this is how I've divided up the content. So today we'll go over just briefly data sources, given that some of you may not be as familiar with health data and where you might be able to get it. And then go into the more nitty gritty of, how do I identify a key message? And then how do you choose a data visualization based on what you want to convey? And then integrated in these next 2 days, there'll be some discussion activities for you to apply what the content. So how we're going to get started is I'm going to show you, I'm going to redo this simulation with you that we did now, I believe 4 years ago in Tanzania, basically with this project called the National Evaluation Platform Project. So it was called the NEP, and it was funded by the government of Canada. And the idea of the NEP was to build essentially health centers within 4 sub-Saharan African countries where policymakers, high-level policymakers, could identify what are priority policy maternal, newborn, child health nutrition questions I want answered. And then we would work with a task team in each of those countries to identify the relevant data, analyze it, and then answer and disseminate the output of that policymaker's question. And Tanzania was one of the 4 countries where there was a national evaluation platform built, and the NEP was co-led by the Tanzania National Bureau of Statistics. During the project, we had a midterm evaluation, and during the evaluation, these people said, you guys are doing really great work. However, I think you need to focus more on the dissemination piece. And so anecdotally, we had also seen that as well, even though working with Ministry of Health stakeholders and stakeholders in other line ministries in the Tanzania government that supported health, even though they had a public health background or a nutrition background and had studied it possibly in university, I think the actual dissemination of and presentation of results was a weakness that we would see in dissemination events, where, and I'm sure you've been to presentations as well, where you see someone just read out every single data point on a slide or things like that, and it's really hard for an audience to understand what they're supposed to get out of it. So after this evaluation, we worked with the National Bureau of Statistics in Tanzania to design a study to look at data visualization preferences and interpretation capacity among Tanzanian policymakers. And these were decision makers at different levels, mostly high, medium, and low levels, so at different stages of their career in the government. And we asked, basic questions in terms of background and comfort using data and data visualization, but then we also had 2 sets of activities. And so this is what I'm going to show you now. And we're going to do this activity now with you all as the trainees. So what we did was we showed the people that we interviewed, the policymakers, we showed different ways to visualize the same data and a key message or maybe two key messages that we wanted policymakers to get out of the data. So the data was the same and the key message was the same. However, we gave different options to visualize that same data. When we got started with designing this study, our colleagues at the National Bureau of Statistics was like, well, we don't really need to do this because everyone's going to choose the bar graphs or the line graphs. And so that was, an observation before we even started the study that this might happen. And it's something to keep in mind because particularly now you see many more different types of visualizations of data that aren't bar graphs and pie charts. And so one line of thought is, well, do policymakers actually even understand the bar graphs or the line charts that they're being shown? So, and our intention with this study, this data visualization study in Tanzania, was we wanted to know when we got to a point of finally disseminating our results, what format or what do we have to keep in mind in terms of what the data should be presented as when we do our final dissemination? Because we had several policy related questions that we were working on. And at the end of the project, we expected a very, large dissemination with many different policymakers. And so we wanted to optimize how we would present that information. So for this particular activity, and this is from the study, the key message was during the past 15 years, a majority of under 5 deaths in mainland Tanzania have been attributed to the same 5 causes: neonatal measles, pneumonia, malaria, and diarrhea. Between 1999 and 2015, the proportion of under 5 deaths attributable to AIDS has decreased, while the proportion of under 5 deaths attributable to injuries has increased. So I'm going to leave this slide on the screen, and I'd like you in the chat to say which option, so there's 3 options right here displayed, which option you think is the best according to this key message. So you can type your preference in the chat. There's no need to be scared of giving a wrong answer also, because you'll learn with data visualization and choosing the right options, sometimes there are never wrong answers. Sometimes there are better answers than better options than other options. But I'm doing the simulation with you so you can understand, what we did in the study, and this is exactly one of the examples that we used in the study. So I'm going to wait another minute and see what other, if anyone else wants to share their opinion. It looks like there's quite a range with most people choosing option 2. Okay, so it looks like a majority of individuals have chosen option 2. So I'm going to make this a slide again. Okay, so option 2 is the bar graph. We're going to revisit this at the end of training tomorrow and see if maybe your choice changed, and we'll discuss, what option might be better than another option. Okay, so similar to the last example, this is another set that was shown to policymakers in the study. And there's the key message here for this set is antenatal care coverage varies by household wealth in mainland Tanzania. The gap between the poorest and the wealthiest has increased over time since 2005. So like before, I have 3 options for you. Same data set, 3 different options. The first is a bar chart. The second is a dot plot, and the third is a scatter plot. So similar to before, in the chat, I'd like you to put, to share which option you think is the best to support the key message identified.
Hi, Tricia.
Hi.
I'm unable to choose to participate in the chat for some reason. I suspect this may be happening to other people.
You're unable to choose, as in you cannot decide?
No, I'm unable to because it tells me I'm no longer a participant when I go to chat.
Oh.
Yeah.
I'm sorry that's happening to you. I'm not sure. I'm not sure how to resolve that.
Yeah. No, it's okay.
So you don't have a chat option within your team screen?
I have the chat option. When I open it, I can see people's, but it tells me I'm no longer a participant, so I can't.
Oh, I'm sorry. That's very strange. Well, sorry to put you on the spot, but do you want to verbally share what might be your, what is your option? What is your favorite?
Hi, the first one.
The first one, okay. Would you like to share? Would you like to be extra brave and share why?
Well, in the choices and given the choice of audience, that would be the easiest. I wouldn't do a box plot for lay people.
Okay, thank you so much. I'm sorry for putting you on the spot for your for vocalizing your issues with the chat, but I appreciate you sharing verbally your answer. So almost everyone also selected number 1 in the chat for now. There are some people who chose 2. Again, we're going to revisit this actually at the end of tomorrow's training session to see if your option has changed. But thank you for sharing and sharing what your preference was. But another thing I want to emphasize is, people did have different preferences, and this is just, people have different preferences in what types of food they like to eat or what types of activities they enjoy, and everyone has their own, I guess, view. And so that was one of the objectives of the study, is to show, what do policymakers actually want to see. So I want to get started just by defining what is data visualization. And it's the process of graphically displaying data to tell a story. And so the emphasis is on the process, because it isn't just graphs, it isn't just a dashboard, but it also encompasses the thought that you would put behind thinking what needs to be visualized and what do I want to convey. So at the bottom of the screen, there is a map, and it's considered one of the first uses of data visualization in health. It's called the Broad Street Cholera Map, and basically there was a cholera outbreak in London, and so an individual plotted on a map where all of the outbreaks were happening, and then the conclusion from that map was, well, I think the thing responsible for the cholera outbreak is this pump that's on Broad Street, and that was based on mapping where the outbreaks were. On the right side, I have a pie chart, actually 2 pie charts. And, I'm sure you've all seen pie charts like these, which have many, many, many small slices, and are possibly, in my opinion, a little difficult to interpret because there's so many small little slices here. But I just want to show it as an example of, something you might see very frequently of these busy pie charts. And the purpose of this pie chart is to show a distribution, a proportion of different things. In this case, it shows global and regional mortality from different causes of death between females and males. And so this is from the Global Burden of Disease study, and something that I want you to keep in mind in how different people approach data visualization. So I previously volunteered for an organization called the Data Visualization Society, and it's a professional organization of people who work in data visualization or do work that's related to data visualization. So it's quite a diverse group. And one thing I had done through the Data Visualization Society is I had facilitated discussion on what are principles and best practices and things you've learned from data visualization in low and middle income countries where technology might be more variable, print media might be more important, and there might be other forms of communication and other technology access issues to consider. One individual in the discussion shared the graphic is only as useful as the audience finds it. And this is applicable, I think, not just to visualization in a low middle income country setting, but any type of data visualization. And why I like this quote is it encompasses a lot of things that could potentially go wrong. For example, if you work on creating a very beautiful graphic, a very beautiful data visualization chart or whatnot, or a dashboard, and someone cannot understand it, you've really lost your purpose because the audience may not be able to interpret what you're trying to get at. So that's one example of how this quote can come about. But also in terms of optimism, you as the designer have the power of creating a chart or a graph or a dashboard or whatnot that someone, an audience, can understand and can find actionable. So it's something to keep in mind is to always think about your audience, their data literacy, and their interpretation capacity, and then to also build based on that. Because if you create a data visualization that someone cannot understand, they're really it's sort of a fruitless effort. So the first thing I'm going to talk about, which isn't even strictly about data visualization, but I thought it would be helpful, especially for those of you who are less familiar with health data, are different sources of health data that you can access in your work. So on the left side, I have listed some examples of official Tanzania sources of data. So from the National Bureau of Statistics website, the Ministry of Health. There's also a routine health data system that I believe is not publicly accessible yet. And so that's facility level health data that comes from all the facilities in Tanzania. I think there's currently a partnership working to make that more public. And then on the right side, I have listed some more global sources of data and some of them are done in partnership with the Tanzanian government. So like the demographic and health surveys, which are the most widely used sources of health data globally, and they're conducted in all low and middle income countries depending on the country, every 3 to 5 years. And then WHO Global Health Observatory, UNICEF data, World Bank Open data. These are all aggregates of different data sources and different modeled estimates. So one thing to keep in mind is the DHS and information from the National Bureau of Statistics and Ministry of Health. They are generally survey data, whereas if you look at data from UNICEF or the WHO, that integrates more modeled estimates. So those are based on statistical models that those parties have created. Here's an example of use of DHS in the media for the last Tanzania DHS. So that was in 2015. Currently, there is a DHS that is being conducted in Tanzania, and it's slated for I think data collection is occurring right now. But when the last DHS came out in 2015, 2016, this was an article from The Citizen about a young child getting vaccinated. And so I have shown here on the slide the text that said, from the 2015-2016 DHS, it said that, vaccine coverage increases with household wealth, and describes how vaccine coverage varies based on mother education and also residence. And so this is all an example of the use of DHS data in the Citizen. So the next thing I'm going to cover is a key message, which is very important to deciding what type of data visualization you should consider. So how do we make good data visualizations? We first have to identify the appropriate data source, and then identify what you want your audience to remember. So that's the key message. When I have done this training in person, sometimes I am very mean, and I have the participants all come up with key messages, and then I'll wait a while and then pick a random person to tell me what someone else's key message was. And the purpose of this exercise is that you want to create a key message that someone remembers. And part of the purpose of creating key messages is, as humans, our mental capacity to remember things is quite limited. And there have been studies that show that if you give someone too much information, they won't remember very much of it. It's called information overload. So you want to be thoughtful and think, what do you want someone to remember? And then that's what you're going to base your decision on, the type of visualization based on that key message. And then once you create your graph or your chart, you want to double check that your data visualization is aligned and supports your key point. So here's an example of COVID data from Malawi. So unfortunately, we don't have this data for Tanzania. The World Bank conducts mobile telephone COVID-related surveys in, I think, maybe 8 or so countries. And so this is an example of their most recent report from Malawi on the impact of COVID-19. So here in the graph, it shows the hand washing with soap after being in public and mask wearing, and it's separated based on a month, and so it shows a trend over time. So my question to you, and you can write your answer in the chat. If you do not have access to the chat, you can unmute yourself and verbally share your responses. What do you think is the key message based on this graph? So again, here's an example of a graph from the Malawi Bureau of Statistics and the World Bank on their COVID-19 impact monitoring. And so what I would like to hear from you is, what do you think is the key message from this graph that they produced? Williams, I noticed that you have your hand up. So if you would like to speak, please feel free to unmute yourself.
I think for me, I can say the majority wash their hand after being in public.
Great. Thank you so much. It also, it seems like other participants are sharing very similar key messages with some distinctions. So one individual says the majority say they wash their hands after being in public. Acceptance of hand washing and mask wearing is high. Hand washing was frequently used between the first 2 months of the year. After that, the action was slowly not implemented. I think the message is that the most households have increased hand washing practices after being in public. So I just want you to note that there were some similarities with what you have shared on your key messages. Yeah, so the change of folks, of people who have washed their hands with soap after public. There was one individual, one participant in the training who noted some change over time and how that proportion might be changing. So here is the actual, in the box, this was the actual key message that the Statistics Bureau and World Bank identified based on this graph. Over time, it appears there is more laxity in following the COVID-19 preventative guidelines set by the authorities, and this could partially be because people are becoming less and less worried about becoming seriously ill from COVID-19. So this was the actual key message that they identified. So I just wanted to point this out to you because, you know, when you show someone a graph, people can get very different things from the graph. And that's something that that is great because, you know, people can have varying opinions on how to interpret data. But also if, you know, you are a journalist or you are an advocate and you want someone to remember a specific message, like for in this case, the change over time of and decrease. So if we look at this graph, in January 2021, 60% of respondents said that they washed their hands with soap after being in public and wore a mask. Whereas in May 2021, so later in the year, only 41% said that. So yes, the graph does show everything that you as training participants identify. There is high, so that the green bars are quite high in proportion to the other bars. So there is significant compliance, notable compliance to hand washing and wearing a mask. However, there is a decrease over time. So I did want to show you this example because it's important to keep in mind, if this is your intention to communicate this change over time and this decrease, how might we use different strategies to emphasize this key message better? Since, as in this example that I've shown you, people can get different, people can interpret the graph differently. So based on your key message, you can identify what types of data visualization approaches might be more appropriate. And actually, with a key message, more often than not, they will fall into the same types of categories. So either comparisons or an emphasis of a single number. In terms of comparisons, generally what you see in key messages and the common key messages that you would likely want to emphasize is how numbers are the same or different, how numbers compares to a total, or how numbers change over time. And so these are, a very simple categorization of what a key message would be. So here is another example of data that I've taken from Reuters, which is a global news outlet, of they prepared these graphs, and it shows the distribution of different variants of COVID in different regions. So based on this example, I'd like you to type in the chat, or you can unmute yourself and share, what do you think is the key message from this set of graphs that the news showed? Okay, we have one brave workshop participant who shared a distribution of variance across the continents over time. So let's go back. So you'll notice that for this particular set of graphs, the news outlet, the key message is actually the title of the graph. So the title of the graph here is "The more contagious Delta variant is becoming dominant." And so it's a comparison of the different COVID variants across both time and across regions. But the key message that they have identified here is more contagious Delta variant is becoming dominant. And then if you remember, I showed you a couple slides ago that basically you can categorize key messages in very simple terms, and they'll fit within these categories. So in this example, the key message is how one number compares to a total and also how things change over time. So I'm going to pause here before we proceed. Does anyone have any specific questions on key messages or data sources? Okay. If you do have questions, please feel free to put them in the chat, and we'll proceed with the rest of the slides for today. So the first category that I want to describe is comparisons and how two or more numbers are the same or different. And most commonly, these are the types of key messages that you would want to convey. So you all are familiar with a bar chart where each bar represents, one category, and they can be horizontal or vertical. And variables in a bar chart can be discrete. So you can use a bar chart to show, sex, region, race, and be organized in categories. Bar charts are the most frequently used approach to compare two or more numbers. Like as our National Bureau of Statistics colleagues stated, everyone will always choose a bar chart because people are most familiar with bar charts. However, one thing to keep in mind is they might not be the most effective option at all times. So in this training, whenever you see a green box with a little symbol of a brain, I have flagged some type of research that has been conducted to, support or provide some clarity on when you should use what based on psychological research. So just as a background, data visualization research is most commonly led by psychology, cognitive science, computer science fields, and they conduct studies to see, what do people understand quickest or easiest, and do more of this exploration of comparing different types of data visualizations. So studies suggest that bar graphs are most effective for two categories, and this is because studies show that our brains can process 3 to 5 groups with 2 columns per group. Any more groups or columns can be challenging for our brain to interpret, and so we might struggle when trying to read a graph with many groups and many categories or columns per group. So now that I've shown you, the evidence and some of the research behind bar graphs and why they might be challenging, I am going to proceed and show you some alternative options to using bar graphs. So the first is a slope graph, and slope graphs are useful for comparing 2 categories and emphasizing how some categories change faster than other categories. And why this is, proven to be, an effective technique is our brains are tuned to think about if things are increasing or decreasing. That's what we first notice. So if you show someone a line graph, the first comment they're going to share is, this line is increasing, this line is decreasing. And it's because our brains are attuned at looking at slope. So here's an example of data from the Tanzania 2015 DHS showing nutritional status among women aged 15 to 49. So it's showing overweight and obese compared to underweight. And it's comparing two different survey years, 2010 and 2015-16. So on the left is a bar chart. The right side is a slope graph. Same data, but visualized in a different way. The advantage of the approach on the right side, the slope graph, is you can see the green line to the top line. The rate of change, the slope, is more steep than the bottom line, which is yellow, which is underweight. So for underweight, we see it's about the same, or dips a little. So we know that underweight decreased between 2010 and 2015. But then when looking at overweight and obese, the rate of change is a lot more drastic. This is a dot plot, and so dot plots are increasingly being used to visualize health data, and they're also called equiplots, and they're called equiplots because they visualize equity. They're often used to visualize equity. So different differences among groups of different wealth quintile or maternal education. And the premise of using a dot plot is that our brains think of things in common axes. So our brains are tuned to looking up and down and left and right, so in planes. And so our brains are looking at space on a common axis. Our brains can more quickly judge space on a common axis than varying axes. So that the alternative would be a bar chart. So on the top right is an example of a dot plot. And it's showing the percent of women receiving antenatal care 4 or more times by wealth quintile in Tanzania. There's 3 different years on the y-axis. And there are 5 colors. Each dot represents the estimate for ANC coverage for a different wealth quintile group. So the dark blue is the richest group, and the ANC coverage is the highest among the richest, and it's for 2 of the years, ANC coverage is lowest among the poorest households. Another advantage of the dot plot is looking at the length of line. So the length of line represents inequity. So in 2004, in this particular example, the length of line, so this is, I'm referring to the length of line between the poorest and the richest, that line is shorter than the line between the poorest and the richest in 2015. When the line is longer, that means that inequity is higher. There's a greater difference between estimates among the richest and the poorest. Here's an example of a dot plot used by Reuters Graphics, another news outlet, and it showed how the EU, it shows the timeline of the EU getting a vaccine, COVID vaccine deals. And so several months ago, and I believe I took this, this graphic is from April. The key message that Reuters was showing is why in the EU, purchasing of vaccines and the rollout was, purchasing of COVID vaccines was slower than the UK and the US. So in this example, there are 3 lines. The UK is the top line, the US is in the middle, and EU is the bottom line. The size of the circle represents a dose for each person in that country. And this dot plot is plotted against time. And so the EU, the blue line, the bottom line, starts after the UK and the US line. And so this is shown, this dot plot is used to show gaps between time and also comparison of these 2 different regions. A dumbbell plot is a type of dot plot, and it's called a dumbbell plot because it is like the exercise weight. So on the left is an example of a dumbbell plot we have used to show a change in skilled birth attendant coverage. So this is when women give birth and they have a skilled birth attendant. On the y-axis are different regions in Tanzania, and each dot on the left side represents two different survey years for DHS. So there's 2005 and 2015, so a 10-year gap. You'll notice, based on this graph, you can see how at the top, those countries with the longer line made better progress at improving their coverage of SBA. Whereas, for example, in Dar es Salaam at the bottom, skilled birth attendant coverage was already quite high at about 95%, and the length of line is a lot smaller than the length of line at the top because SBA coverage was already quite high. On the right side is an example from the New York Times in the US, and the newspaper was just using this dumbbell plot to describe COVID outbreaks in prisons. And so on the first column is the states in the US, and then the first dot is the case rate of COVID for the entire state, and then the dot on the far right is the case rate in state prisons. And so this dumbbell plot is to emphasize how much greater COVID infection was in prisons in each of these states. And the person who designed this graph also, wrote the actual magnitude within the length of the dumbbell line. This is another example of a dumbbell plot, slightly different from the other examples in that there are arrows. So the nice thing about the arrows is it's showing some direction, some directionality of increasing and decreasing. This is from, so WHO and UNICEF and World Bank every year put out a report of malnutrition estimates. This is from this year's edition, the 2021 edition. This graph shows the current levels of overweight have persisted for the last 2 decades in almost every region. So that is their key message. As I mentioned, they are using the title of the graph to encompass the key message. And if you look at the actual graph, the dark blue is 2020, and the lighter shade is 2000. So it's a 20-year time span. And so you'll notice that in some regions, like Eastern Africa, where you have in 2020, the estimated percentage of overweight is 4%, which is an improvement from 5.3% in 2000. And so there's a line, an arrow that's going down to show this decrease. A lollipop plot is another type of dot plot, and it's called a lollipop plot because of the candy. And so on the right side is an example of a lollipop plot that we used during our presentation. And so this is